am super excited to introduce you to all three of my amazing certified nurse practitioners here at MiBella Wellness Center. We're going to start with Brittany. I'll let her introduce herself. And then can you just talk a little bit, Brittany, about your history and your background and how that's allowed you to be able to do what you do at MiBella Wellness Center as a certified nurse practitioner and our lead certified nurse practitioner.
Yes, well, my name is Brittany. I have been working here at MiBella since 2020, so I came on during the pandemic. Yes. So it was kind of coming on. They hired me because there was going to be such an influx because everything had been kind of shut down and everyone needed to kind of get caught back up on their annuals and also they needed an extra hand. So Doc found me on LinkedIn.
I was like, hey girl, you looking for a job?
And I said, yes, I am. And I found it was a great fit, and I've been here and happy ever since. My background, I was a labor and delivery nurse for about 7 years. Loved it, but I just wanted to add a different facet onto what I could do to kind of help patients. So I decided to go back to school, went to USA, home of the Jaguars. I'm a dragon too, UAB, but I got my master's at USA in women's health. And then after I graduated there, I started working for the health department. Of course, with the health department, you kind of travel around to a couple of different counties because you have smaller counties. So I was traveling all over this great state of Alabama for a couple of years doing that, which I loved.
Oh, great.
I did, but I felt like it was kind of very limited in what I could do, and I kind of wanted to expand. But the health department was a great place for me to really get a really solid foundation. So I will always appreciate the health department, but I kind of wanted to do other things where I could layer in and kind of use my degree more. So doing more complex cases like we do here, such as, hormonal replacement therapy and intimacy services. So I'm happy that I get to use the full of my degree here at MiBella.
Yay. We are so happy to have you. All right. And then there's Valerie. Valerie, one of our favorite certified nurse practitioners. She's actually our newest. She absolutely loves TV. She was so excited to do this today, and we are so excited to have her. But she actually brings in a real kind of different, diverse background. So I know you have a history of burn and trauma, and when you say burn and trauma, people don't really understand like the intensity of that and the detail of that field and how difficult the patients are emotionally, how to take care of them physiologically and medically. So very, very complex. So now you're here at MiBella Wellness Center and you're a certified nurse practitioner. You've been here for almost over a year now, right? And you started as an intern, and then you moved into part-time, and now you are full-time certified nurse practitioner at MiBella.
I love it every bit.
And we know you want to find it.
You really did.
So tell us kind of what you bring from burn trauma and what you've been able to kind of bring into MiBella and make it a better place for patients to come.
Okay. Like she said, her name's Valerie. I'm one of the new face around here. A lot of people are getting to know me. Yes, I've been in trauma burn for 8 years before I came to here. I've been at MiBella for over a year, but at trauma burn ICU, I really learned the importance of providing patient care, individualized patient care, because you wouldn't treat a trauma patient the same way you would treat like a burn patient. And also you really do learn compassionate care because these are the worst times in people's lives when you're at trauma burn ICU. So you really have to be patient and just bring your best self so they can be their best self. And so I brought those approach over to MiBella. And so here, unlike in the hospital, you don't get to really know your patients. Here we get a time we can sit down, have conversations, try to chit chat, and I get to know you a little bit better and develop like a treatment plan that's based on your needs. It's individualized to you because your treatment plan won't be the same as somebody else's.
Lovely, lovely. And she said she don't like TV. She how people be doing that, right? Well, Yaleshia definitely has been around for a really, really long time. I saw her grow up from a high school student to college, all the way to all the things. So you bring a vast amount of information and expertise to MiBella, and you've seen MiBella from her being a little bitty baby, a little two patient rooms down in Inverness to where we are now. And then you came in as a student, and then a medical assistant, then a nurse practitioner, and so you've been able to kind of watch us grow and develop. And you've worked at other places. What is it that stands out to make you come and work at a place where you do something that you don't love? Because you don't love gynecology, you love the patients, but it's not your favorite thing. But you still take time out and you come and take great care of patients at MiBella Wellness Center. What keeps bringing you back?
So in family medicine, it's really easy to just diagnose somebody like anxiety, depression. But I know working with Dr. Cowan, doing all the hormones, I'm like, you don't need to be on all this medicine. You just need your hormones fixed, and we need to check your levels. So I feel like in family medicine, I bring that because a lot of people in school, you don't really get a section on hormones. It's kind of just, hey, menopause, oh well, deal with it, use a fan. Mm-hmm. No, Dr. Cowan has taught me so much, and a lot of patients are overprescribed anxiety, depression medicines, and they really just need their hormones fixed. Mm-hmm. So I feel like, and I probably do spend a little bit more time because I'm thinking like the whole body and all these other things. So that probably gets me in trouble a little bit here because I go overtime. But Dr. Cowan lets me do my passion, and and even though I do family, I do enjoy gynecology. I learn something every time I come and work with Dr. Cowan. I'm like, when did that change? So yes, and she pushes me a lot of things. I'm like, do I have to do that? She's like, yes, you need to do it. And she's constantly teaching me and helping me be the best provider I can be.
Yes.
So I'm very grateful for that.
Yes. And I am so blessed to have 3 amazing nurse practitioners that like believe in my vision, and if they don't, they know how to pretend.
We believe.
That come to work every day and take great care of my patients. Like when my nurse practitioners are gone, now when I come in the room sometimes, they're like, oh, I thought I was going to see Brittany. Oh, I thought I was going to see Valerie. I'm like, well, you got me. I'm sorry. Brittany had to have a baby, so you got me today, okay? So everybody's happy Brittany's back. Brittany is back. Look, Yaleshia is still coming back. She thinks she was just dropping in for a minute and she's doing PRN. But y'all going to see a lot of Yaleshia because she can't stay away from us, and she loves our patients so much.
I will be back.
And I do appreciate you, Yaleshia, for kind of stepping in the gap while I was out.
Yes.
To allow me to like be at home and be with my newborn a little bit. But
I was glad to do it. Your patients, they were like,
where Brittany?
They were like, so am I seeing Brittany? I'm like, well, she had this beautiful baby boy, but she's coming back. So yes.
They were happy to see their Brittany. I'm like, and that's what I told somebody. I was like, well, you get to see Brittany next time. Okay. And they were like, okay. So as you can see, I have 3 amazing nurse practitioners, providers. They are Dr. Mia certified, MiBella trained. I would not let them work with the patients that I love and care for like my own family unless they were amazing and great. So I have 3 brilliant nurse practitioners that care a whole lot about our patients here at MiBella Wellness Center, and they allow us to do what we do. So a big part of our work, we take care of adolescents, we take care of men, we take care of women, we focus on gynecology, we focus on wellness, so many things, but a big component of our patient population are women and men now in their midlife journey. So when they're in their late 30s and 40s and 50s and 60s, and how they're aging and all the problems that they're having, and how we've been able to add these services to make this transition in life sexy.
Yes.
Can y'all say that we making it kind of sexy?
Making it sexy, absolutely.
So how are we making it sexy? And like, what have you noticed? And anybody can jump in wherever y'all ready. What have you noticed, and what's been like your most grateful moment for being able to serve the patients that we serve the way that we serve, and what particular service or experience or patient example without their name, because we always go by HIPAA.
Absolutely.
I think the pellets, we've had a lot of patients come in the beginning, they're, at their lowest point. And then when they come in for their 6-week lab work, they're like, hey, I brought desserts, I brought lunch, what y'all want?
Right, yeah.
I feel good.
I love her. She's great.
And I was like, okay, and so that is very satisfying, knowing that, you know, just something as just balancing the hormones can change someone's entire life and even their marriages, relationships. I know a lot of people come in and they're like, I'm about to like get a divorce, like my family, nobody wants to be around me, and then they come back and like, you guys saved my life and my family, my marriage. So that's awesome.
Yeah, I think that's probably the biggest thing that I've seen since I've been working here is how big a factor your hormones kind of play in your life, and when they're not balanced, how big of an effect it can have. But yeah, I've definitely had on a lot of occasions patients come and say, hey, me and my husband are not getting along. He is wanting a certain amount of intimacy that I literally cannot give him, and I want to.
And I still love him. I'm still attracted to him. I just don't want to have sex.
And they really feel like something is wrong with them, and I want to say, well, no, nothing's wrong with you.
It's your hormones.
It's just your hormones, and we can fix that.
Right.
So let's fix it. So and seeing just the stark contrast of how they come in and when they come back, it's like a complete 180. Like their energy, their demeanor is completely different.
They're not mad at the front desk for asking for their payment. I mean,
no, none of that. And even just with like the intimacy portion, I guess that kind of goes into with the hormones, such as like the O shots, the P shots, O wave, P waves. Like even with that, right? And and knowing that that's a part of the intimacy too, and kind of getting more blood flow and everything, knowing how it is before and afterwards, and how they rant and rave, and they say, yes, my husband is completely happy, or yes, my wife is completely happy, is something
I forgot
great.
the sex could be like this again.
Yeah, and it was like, well, when is the next time I need to schedule my appointment?
Right. I will be back.
But I love when the couples like when the wife comes first and then the husband comes a few weeks later, and they're both like, I'm like, okay.
And then they both getting all their stuff. They get the weight loss, and then they doing their pellets, and then they having their intimacy services, and they're just like the happiest little people in the waiting room.
And
everybody's happy.
And I can't remember that a couple of women have got some new cars.
Yeah.
Babe.
I'm like, it's
got their whole house back.
So, you know, people get motivated.
That's right.
Yeah. So
what about you, Valerie?
Well, I would say about the gynecology aspect, some parts are rewarding because some women come in, they're at their wits' end, they've been bleeding heavy, don't know what's going on, bleeding through their clothes to the point where they're feeling lightheaded, they're anemic. All we do is just run an ultrasound, find out they have fibroids, and treat them, and it just changed their life completely. Find different ways to, like, even when it comes like birth control, either a medicine like myofembrate or something just changed their lives, and they're not bleeding as heavy, they don't feel lightheaded, they don't feel drained, they don't feel as fatigued as they used to. And also the screening part, just getting those early mammograms have saved lives. Getting a baseline at 35 and doing the screening for pap smears. And sometimes when we're doing our exam, we might see something that a patient doesn't notice and say, have you looked and noticed that you've seen such and such look like this? They like, no. And then so we end up running biopsies and treatments, and that could save a life too.
Yeah,
because we pay attention and care.
Yeah, and I know, just kind of piggybacking off of that, I think they appreciate how thorough we are. Like we actually like sit down and we go over stuff, or explain what their options are. We just don't immediately say, hey, you need to have a hysterectomy. Not everybody wants a hysterectomy. They want to know what the other options are. So
some people haven't had kids yet.
Yeah,
and they'll go to a doctor that tells. I'm like, if somebody tells me they want kids, I don't even have a conversation about a hysterectomy. We're gonna figure out what are all the things we can do so you can maintain your fertility and live your best quality of life. If that means having a myomectomy, or means having a hysteroscopy, if that means medication, like whatever it is. But a lot of our patients come to us because somebody told them that the only thing they can do is have a hysterectomy. And they telling young women who have not had their children, or who don't have all the children that they want, that their only option is to have a hysterectomy. And unfortunately, a huge number of those, which contributes to the healthcare disparity, are Black women who are being told that their option is to have a hysterectomy. And at MiBella, we know so many other options.
Yes,
so many. We have had women. I had a lady who was 46 years old. They told her she had fibroids and she just could have a hysterectomy. She was like, no, I want children. They were like, you're too old to have children. She met her husband. I sent her to have the fibroids removed. She kept her uterus. She carried her baby at 50, and her baby is 2 years old at 52.
That's
and she
awesome.
is happily married. Neither one of them had their own kids.
Yeah.
And they were able to do that because they came to a doctor who cared enough to give them another option. She was at her wit's end. Like, they told me all I can do is have a hysterectomy, and this lady has a baby. So that's what we do at MiBella.
Yes,
You know what I
right.
mean? We come up with different ways to treat people and give them great treatment options and respect them for who they are. And no matter who they are, if they walk through our doors, they're going to get the very best care possible. And they're going to have a huge voice in their care, because our goal is to educate and give them the options that they're happy with, which is going to be different for everybody. And we don't judge.
At all.
And even if
At
it's
all.
something that we personally can't fix, we get you to the right
Person.
person, specialty that can fix it.
We don't just say, well, that's just something you got to live with. Pelvic pain, you're just going to have to live with it if you don't want to have a hysterectomy. No, we got ways to control pelvic pain. So that's the rewarding work that we do over here at MiBella. So we give them the hormones. We talked about the intimacy. I think, too, what's also been very rewarding for me lately is not only the gynecologic part, working with the adolescents, being able to educate more, give people different options, the right treatment options, the right information. But I do think that weight management has been really gratifying to me.
Yes.
To watch people who didn't think they were going to be able to lose weight because of age or because they were in menopause, to be able to come in and do our program, learn how to eat healthy, learn how to exercise, make those lifestyle changes, and they're losing 20, 30, 40, 50, 60, 70, 80 pounds. Like large numbers of people who actually come and do the plan. So to me, that's like one of the most gratifying things, to be able to do that, to change your life, your health, and your whole trajectory just by living a healthy lifestyle and changing
And
your
you
body.
do it the right way. You're actually teaching them, getting their resting metabolic rate, calories. You're not just like, here's a shot, take it every week.
Yeah.
If they need to stop the shots, they're fine. They can keep their weight off and maintain it. So that's what makes you different. You're not just like, here's a prescription for a shot. No, you're like,
what can we do to make sure you can come up with a lifestyle that you can lose it and keep it off
Exactly.
with a little support
Exactly. And accountability, because that's what we're here for.
and accountability.